I don't just think it's relevant to Africa and African women alone, but I think that it's relevant to the entire globe, and it's a crisis. And the reason I describe it as a crisis is because then zoning back to our African women and our continent as well, is that it's a crisis of gender equality in the sense that it's going to lead to a lot of regress. It's going to give governments, for example, who are really restrictive on abortion or who want to lean that way, an excuse to sort of follow that path. And then finally, at the very level of our communities, it changes social norms, for example. It changes the acceptance of women's rights to decision making. And for the women themselves, it also, one, can affect your decision, your body, your bodily autonomy. But then also the case of going through with an unwanted pregnancy, for example, affects your entire life course.
Yes, my question was on how sexual and reproductive health rights for women who are in Africa will be affected by the overturning of Roe versus Wade. Because from my understanding, maybe the right to contraception use might also be affected. So I just wanted to understand how that will impact maybe a woman in rural Western Kenya trying to access abortion services. Yeah.
It's nice to connect with you all the way in my second home, which is Nairobi, Kenya. And, just then turning to how this affects sexual and reproductive health services. In 2017, under the Trump administration, we saw the global gag rule and the Mexico City policy. And what that led to was putting restrictions on funding. And there's quite a bit of evidence which has emerged from that sort of turning point, where we saw that international NGOs, local NGOs, now had to shift the way they deliver services. They also had to deliver fewer services, and they also had to change the way they frame the delivery of services. So I think that was already a starting point. I don't think Roe v. Wade is the starting point immediately. What this then translated to on the ground is, for example, you had an NGO which would provide a comprehensive list of sexual and reproductive healthcare services, which I'm sure you may know, Daisy. So from maternal health to contraception, to abortion, to comprehensive sexuality education, to violence as well. And the cutting of the funding and the infringement and certain conditions led to a drawback of those services. But what we also saw as an offset, it affected HIV services. And overall, what you find is that every single sexual and reproductive health service is so interlinked that if you regress on one of them, all of them will be affected. And just to give another example, thinking about unsafe abortions, how does this link to maternal mortality? The World Health Organization states that we have 55% of safe abortions in the world. So the remaining percentage is unsafe. And unsafe abortion, which we see globally, leads to maternal mortality. And so for me, it's a really chilling and a really scary situation that we find ourselves in.
What are the economic implications of Roe v. Wade being overturned on women in Africa? Because we've just said, Black women are 3 times more likely to have complications during pregnancy. So I was wondering how this would also affect them economically, or the fact that women who are poor are the ones who will not have access to abortion services, even if it's made illegal. So this pushes them to the unsafe options. So what are the economic implications?
Daisy, I think it's a question that we need to break down to at which point of a woman's life does she seek an abortion? And is it a teenage girl? And if it's a teenage girl who was possibly a victim or survivor of child marriage or gender-based violence, or out of her own will had fallen pregnant or had an unintended pregnancy, then not being able to access an abortion service means that they would drop out of school. What we find across the continent and across the world is once you drop out of school, to get back in is really difficult, or to complete your education. Not completing the education means a lifelong journey of poverty and difficulty, right? But also not just for the woman alone, for her family, the dividends that we sort of anticipate in the value of women being part of the economy, and then the well-being of the child. So there's a different generational impact and economic impact across generations for the lifetime. If one is then at university and you're seeking out the service and you're unable to access the service, that of course affects you, again, dropping out of university in your life trajectory. It then also affects if you're in the workforce. And, I work with an incredible colleague who released a gender pay gap report at WHO. And what we find is that motherhood affects women's pay gaps. It affects women's earnings. It affects your ability to climb the career ladder. And so your economic impact is there. But across the life cycle, what do we also find is that women and girls are assigned gender roles and motherhood roles or care roles. And so not having this sort of avenue to have an abortion means that what could potentially happen is you have higher levels of unpaid care work. And this really grew during the pandemic, where we saw that UN Women sort of estimated that women carry 3 times the burden of unpaid care work. So there's that economic impact that you can measure, but there's also that unpaid work that we also need to consider, that women also contribute to the economy.
I was reading on the different abortion laws in different African countries, because all African countries don't have a similar law on abortion. In some countries it's totally not allowed, and in some countries it is, in the instance where it's about saving life. So I was wondering about how Roe versus Wade will affect this. Will it affect countries differently, or do you think the impact will be the same on these legislations about abortion in the different African countries?
And I think it's important for us to break down the abortion legislations in different countries, or the safe abortion legislations. And, we've got a scale across the continent. We have the more progressive countries on the continent, like South Africa, which has no prohibition around abortion based on a certain stage of pregnancy. But then we find countries which completely prohibit abortion. We find those who allow abortion, but for medical reasons or the preservation of life. And so, I suppose Roe v. Wade is going to, if you're always this part of these United Nations discussions or big policy discussions, it's so fascinating to see member states. And you see those who support abortion and women's rights, absolutely, and those who support it as well. And what this does is it creates an environment where the opposers are able to have an excuse. And they're garnering support, and the pushback becomes stronger and stronger. And so what we may find on our continent specifically is that there's more countries leaning towards opposing abortion. And that means we're probably going to go back a lot in time. They now have that global environment to say, we can do this. It's okay. So I think, that's what I foresee happening. What will also be quite critical is that we're going to see that, these governments are not only going to regress on abortion, they're going to regress on all the other sexual and reproductive health care policies. This really provides that excuse. And then finally, the fact that the funding from the US government, which is one of the biggest donors to sexual and reproductive health, will also be affected. They will now be putting possibly, restrictions on funding to governments. And so even if a government wants to perhaps go ahead with abortion and other sexual and reproductive healthcare services, they're now going to be confined by the types of services or the types of funding that they received. So all around, it is a negative impact that we sort of forecasting for the continent. There's so much of there's so many myths and misconceptions around abortion, and people don't understand why it's needed. For example, in cases of gender-based violence, or when a woman has an unintended pregnancy. So let's raise the awareness wherever we are. That's the one. Two, civil society is mobilizing across the world, and it's about joining movements which are starting to galvanize on that very issue. And three, my current work with UN Women entails working with the Generation Equality Forum, and we've got 396 plus commitment makers globally, which include governments, civil society, youth organizations, and we are coming together to try and really push against this pushback per se. And every single one of us, every single woman, every single policymaker, decision maker, men in the room as well, and other genders, we need to rally behind women's rights are equal rights.